Hello everybody, Dr. Deaven here at the Spring Hill office, and today we are going to be discussing pregnancy and specifically the Webster technique. So for pregnant women, it is 100% safe to get adjusted all throughout your pregnancy. Your entire pregnancy, you can get adjusted and not have any issues. When we adjust pregnant women, we do a couple of different things that help maximize growth for the baby, room for the baby to grow, and we take into account your aches and pains that are happening as that baby grows. So Webster technique was specifically designed to benefit the pregnant woman. It's looking at the pelvis, the muscles, the ligaments that are shifting and moving around during pregnancy, during the growth of your baby. Especially during those growth spurts that tend to happen, the pelvis and those muscles and ligaments, they can get shifted and they can feel off, they can cause pain, tension, it gets harder to roll over in bed, it gets harder to sit, different exercises, it can get harder to do those. So Webster is going to go through and look at the bone, the muscle, the ligament. So on the back side, we're looking at the sacrum, the iliums, the piriformis and glute muscles, and then the sacrotuberous ligament. On the front, we're looking at the pubic symphysis, because as the pelvis starts to grow and shift, getting ready for the birthing experience, that pubic symphysis is supposed to look like this, and it kind of starts to, it can get shifted out of place. One side can go up, it can go forward, it could go back, and it is very uncomfortable. It can be extremely painful. Right now I have not experienced the severely painful because I get adjusted a couple times a week, but I definitely notice when baby is moving a lot. I definitely know when I'm out and I need an adjustment. So as we're shifting and moving, that pubic symphysis is shifting and moving. Then we check the round ligament. Round ligament attaches from the baby down to the bones in our hips, and when that gets tight on one side, it starts to pull, and when it pulls, baby doesn't have enough room or is constrained within the uterus. And then we check the psoas muscle. Psoas muscle is like your hip flexors, and when those get tight, it pulls us down, and once again, baby doesn't have as much room, and that increases a little bit of our discomfort. So we really focus on working on the bone, the muscle, the ligament, and the pelvis to help with that. So when any of those three are off or out of balance, then the baby has less room to move around comfortably, and then if baby's not comfortable, mom's not comfortable. So the next thing that we really focus on, especially during the Webster training class, is as a chiropractor, people don't think of us as really having a whole lot of knowledge when it comes to babies and birthing and like the OBGYN world, which is why we go and we do this extra training. But as chiropractors, our job is to educate and to tell people, about their body and give them choices. If you don't have options, then you really don't have a choice. And a lot of the time, from what I've seen, we have moms come in and they don't know that there are any other options. And so when it comes to, a medicated birth versus an unmedicated birth, do you want an epidural? Do you know the risks that come with an epidural? Do you want to have a home birth? Do you want to have a hospital birth? What are the risks associated with certain tests that they do. Do you have to take antibiotics for certain, like the B strep diagnosis that some women have, which is not always needed. And so, there's a lot of people who seem to think that just because we aren't specializing in something means that we don't have the knowledge about it, and that's just false. So, a lot of our training is about going in and educating our patients. The first step of education is having people come in and be aware that, we do know what we're talking about when it comes to certain things. And it's empowering to women when they know that they have options and they have choices. If they're uncomfortable with something, giving them resources to go look and research on their own and then make a decision based on that. Instead of just being told this is what's going to happen, you don't have a choice. And that's how it is with a lot of chiropractic nowadays, is we want you to research, we want you to bring in, we want you to ask questions, especially when it comes to your body, and if you have things that you're wondering about or you're questioning, we can help with that. So, got off on a little tangent there, but pregnancy, Webster technique, it's all safe. All 9 months, all 40 weeks of pregnancy. Webster really does help. I'm living proof of it right now at that 21-week mark. As a chiropractor, I do a lot, especially now, I do a lot of research on my own and looking at the different options that I have, not just for myself, but for my baby. So if you have questions or you want to know more about a certain topic, especially with pregnancy, Webster technique, or just chiropractic in general, let us know. Leave it in the comments, and we will get to those questions as they come in. That is all I have for this week. If you have anything that you want us to talk about, send us a message and we can put it on the rotation. You have a good rest of your week.